All right, hi everyone. I believe we are live again. Let me check to make sure everything's working. Sorry about the technical difficulties that we've been having to get us to go live this morning. We have some more important information to talk about today. We're checking in on your mental health once again, with more of us not driving, all at home, might be using substances more than usual. We're here with some ladies who can provide answers and insight as to when that becomes a problem. I'm with Dr. Tanya Sorrell, a psychiatric mental health nurse practitioner, and Nicole Teal, a licensed professional counselor and licensed addictional counselor, both with Sheridan Health Services, a University of Colorado College of Nursing run clinic, and also Nine Health expert Dr. Powell Coley is here to answer any questions that you have as well. Let me make sure that we are going, because we, again, have been having some issues this morning, so thank you for everyone's patience. But you can ask questions about the coronavirus to Dr. Coley if you have those today. But again, we're talking about mental health, substance use. First, Dr. Coley, I wanted to ask you to give us an update first on the coronavirus. I didn't ask you that first time we went live, but just give us the update, the latest that we have today. And I'm trying to unmute you. They won't let me do it, so I'll let you do it.
Can you hear me now? Yeah.
Yeah.
So in the last 24 hours, we did see a big spike in the number of deaths that we've seen so far in the United States, the biggest single day loss. But just keep in mind that these deaths, again, are reflective of things that happened 2 to 3 weeks ago, because the virus has an incubation period of about 14 days. So whatever we're seeing today is actually a reflection of our behavior or interventions from about 2 weeks ago or so. So it was a little bit discouraging, but certainly something, that we shouldn't lose heart on, because it could just be a sign of what happened before. There are a lot of questions about when we can open up the country again, and I think that's the biggest thing on everybody's mind. And really at this point, most of the experts are saying that we don't even have enough testing capacity to test those that are sick, much less those that are asymptomatic for surveillance testing. And really what we're going to need to open up the country is to do that asymptomatic surveillance testing to decide who can go back to work and who can't. So in my opinion, we still have a little ways to go before we can think about opening those floodgates again, but we're just taking it one day at a time for now.
All right, thank you for that update. Again, we're talking about substance use. I'm with Dr. Tanya Sorrell. She is a psychiatric mental health nurse practitioner. Dr. Sorrell, I want to ask you, some of us maybe are drinking more than usual right now. You did answer this question at our first live, but it only lasted a minute, so I'm going to ask you that again. We aren't really going many places, aren't driving much, but when do you know that your substance use is a problem?
You're right in that we're at home and we're more stressed. This is an anxiety-provoking situation. Being at the shelter in place and being concerned about COVID, people may use alcohol more than they might normally. Or what we notice too is that when we're stressed, when we're anxious or sad, we might drink more to help to try to alleviate or decrease those emotions. That's when we see what's called more problem drinking, because we're using alcohol to cope, but that's a really bad coping skill.
If your coping is like 1 glass of wine a day, 1 beer a day, even though you're using it to cope, is that really a problem?
It actually is. The CDC recommends for women no more than 4 drinks per week, and for men no more than 7. So if you're drinking 1 drink every day, you're actually in what's called the moderate drinking range. And that actually can have problems both physically and with your mental and emotional health, because we know that moderate alcohol use can affect your blood pressure, your cardiac status, and as well can cause difficulties with your kidneys. We also know that it decreases your concentration, your memory, and can decrease your emotion and increase issues with depression. So even moderate drinking, 1 drink a day for a woman or 2 drinks a day for a man, can have difficulties. The CDC actually tried to measure moderate drinking at that amount, and they actually had to stop the research study because they already saw as part of that trial that there were difficulties and changes physically and mentally for the participants that were in that study.
Yeah, I think that's interesting. And obviously liquor, bars are closed right now, but liquor stores are open, so people can still get what they need to get. And again, she said, using it to cope can still be a problem. Dr. Powell Coley has to leave us in a few minutes, so I wanted to get her insight before she had to leave. We had some technical issues, so we got on a little later. But you're a cardiologist, mild, moderate drinking. What are some of the health effects of that, even if it's just 1 or 2 drinks a day?
So the American Heart Association has looked at this quite extensively. And for women, they say usually 1 drink a day or so because they tend to be smaller. And for men, they say drinking in moderation means 2 drinks or less per day. We know that from the perspective of the heart, alcohol use can raise your triglycerides, it can raise your blood pressure, it can lower your immune system with respect to COVID, it can lead to problems like early onset dementia, vitamin deficiencies, amongst a whole host of other things. So if you are somebody who likes to drink, then just make sure that you're doing it in extreme moderation. And if you're on any medications that can interfere with alcohol, it's also important to talk to your doctor as well, because there's certainly a tendency as we stay home for us to drink a little bit more than usual. And our bodies are metabolizing it in a different way because generally we're less active and more sedentary as well when we're staying at home. So those are all considerations to think about if you're reaching for that glass of wine.
And then just a social media thing that keeps going on out there, and I think we've gotten this question a couple of times, is alcohol killing the coronavirus? So like if you had the virus or were sick at all, does drinking kill it? Does that help at all?
No, actually, that would be great if it did, but it doesn't, because the virus really lives in your nose and in your lungs. And so drinking alcohol is not going to sterilize it or do anything like that to the virus in the back of your throat. People have also asked about using alcohol to wash their hands or sanitize their hands. And that's not effective either, because vodka or whiskey, most of the alcohols that we drink have about 40% alcohol content. And we usually need about 60 to 70% per the CDC to really sterilize the virus. And it's just not a good idea to pour alcohol directly onto your hands without having those moisturizers and such that are in hand sanitizers.
Right. So yeah, not really effective at all. But thank you, Dr. Coley, for joining us. If you have to sign off, that is fine. And I'm going to continue to talk to Dr. Sorrell and Nicole Teal and get their advice. Nicole, tell us some of the early signs. Dr. Sorrell talked about this a little bit. Some of the early signs that you're using a substance in an unhealthy way, and some ways to turn it around before it becomes a major issue.
Yeah, so Dr. Sorrell touched on a few of these things, but if one is starting to see some consequences in their life and that something's not quite feeling right with the substance use, whether that's interpersonal, whether it's in social or familial relationships, even though we're all at home, we're still, potentially having conflicts with our loved ones. And also, is there risk, increased use happening? Is there a tolerance buildup? Things like this can actually signify that someone could potentially be diagnosed with a substance use disorder. And so not just with alcohol, we know that marijuana stores are open right now, and there's other substances, of course, that can be used. So these things can apply to multiple substances. But for someone to just be in tune with what are some of the consequences that I'm seeing with my substance use, and is this what I want to continue with? And so in order to be in tune with when it's a problem and how to kind of reel that in, I'd say one thing is to pay close attention to the use patterns. They're the drinking patterns or smoking patterns or whatever the substance is. What are those patterns for that person? When are they using? What are the whys behind their use, right? So we know, as Dr. Sorrell mentioned, of course, there's going to be increased stress right now. But is someone drinking or smoking 4 to 5 times a day just to alleviate some of this stress? Well, we know that substance use is merely a Band-Aid, right? And so the underlying anxiety and depression, whatever's underneath there, is still going to resurface later on. And so the other piece I would say is paying attention to mood. But then if we think of coping skills, one of the biggest ones that I use with my clients is self-talk. Self-talk is a huge key to being able to say, like, what's going on with my use? What do I want with my use? What's missing? What's really going on? And then being able to use some mindfulness with that self-talk, like, what is this drink for? Do I really need it? That kind of a thing. Or can I go and choose some other non-substance coping skill that might be better for my mood, for me personally, for my family, whatever that is. And so as hard as it is right now, we kind of have to get creative to find those non-substance related coping skills, but certainly they're there.
Yeah, Dr. Sorrell, I wanted you to kind of weigh in on that as well. Taking care of your mental health right now, some ways to avoid turning to substances for stress relief and anxiety relief. What are some other coping mechanisms that we can use?
And that's going to be really important this time, because we know that all of us are experiencing stress from being in the house, being at shelter in place, and then also concerns about catching COVID. So we first want to admit that it's okay to be anxious, it's okay to be nervous. Talk about, okay, how am I feeling? And what are the fears that I have? They may be affecting me. And then look at building a resilience plan. What's going to help build up my coping skills? What's going to help me to feel better so that I can get through just day by day? Thinking about having a regular schedule and routine. If you were working, get up at the same time that you would when you were working. Remember to take a shower, brush your teeth, do some activities during that time so that you keep on a regular schedule. If you think about you were working and then maybe take a break, during that break, put on a mask, keep your social distance and go for a walk. There are lots of things that we can do that will kind of help with addressing exercise, stretching, watching how we're eating as well. And then when we realize that we might get anxious or stressed, using the coping skills that Ms. Teal was mentioning to help with calming, to feel more mindful, and to feel that you have some control in your environment. One of the most anxiety provoking things, we can't really control this virus. It's something that we don't see, but we can control limiting our exposure to the virus and sometimes limiting our exposure to media. Don't have the TV on all day, news, watch some movies, get together with your family and sit down and maybe binge watch for a little bit, something that's fun or calm, so that you can put something more pleasant in the day. Also recognize that this is a time that you actually really can make good contact with your family. If you're there with your kids, you're going to keep them on a good school schedule. So they have some time that they're working on school, some time where they might be in the backyard playing and having some activity. And that way they can have a routine too. And so that the whole family continues on a regular routine and activity, even everybody sitting down for dinner, kind of talking through your day, putting the cell phones away so you're not scrolling through what's happening, and really spending some important time just going through and discussing how things are going, how your day is, and what you might do for the next day and helping with coping. One of the things that I saw interesting was that at some point, as the doctor mentioned, we will be kind of able to go back and start to do some of the things that we were doing before. And then think about, we've had some time where we really have been able to have connections with our friends, to check in on family, to check in on older family that we might only call for holidays. Remember to keep those important family and friend connections, even as we get back to our busy world, because those are some of the things that we forget when we're trying to do our workaday world and get it in. But those are the things that are really important. And being at home now and kind of saying, what do I do? That's a great time to explore. Who haven't I connected with? Who haven't I checked on? What are some things that could help me to feel more emotionally well and having those connections? I have friends that actually have their regular Saturday, they would go to Starbucks for brunch. So now everybody's on Zoom with their coffee and chatting and getting along and keeping those connections. Because we know that loneliness, even before COVID, was a problem for many of us in society. And that making those connections was something that we had already started to lose with the fast workaday world and everything on mobile phones and chats. So now particularly preventing loneliness and isolation, which can increase anxiety and depression and trigger more substance use, is important to address and to work to avoid. Keeping those connections, keeping your regular routine and activities, and focusing on the things that you do have control over will help you to feel more secure and to help you to meet the challenges that may be coming up.
Yeah, I think that's all good advice. We keep talking about sticking to some kind of schedule is really what is most helpful right now. And all the work from home tips say, still get up, still get dressed, still take a shower, try to live a normal day, like you're actually going to work. Rob commented, as an interventionist and recovery coach, he's loving this live, but he said, for the most part, individuals who used to drink away from the home with bars closed, they're now stuck at home. And so maybe family is actually seeing this problem for the first time in some of their family members. So Nicole, I wanted to ask you, and these ladies are going to demonstrate like a telehealth session for us so we can see how that works, but there's ways to get help right now virtually. either for yourself or if someone notices something in a family member. How would a family member get someone that's maybe reluctant to seek help?
Actually, Stephanie, that's a really tough one because ultimately an individual does have to decide to seek help for themselves. If a family member calls our clinic and says, my family member is really struggling right now, unfortunately, the family member does have to call themselves. But I think regarding that family member and kind of dealing with the person who is struggling with substance use is having candid conversations about it, but also without judgment. We come from a perspective at Sheridan Health Services where we look at substance use disorders as managing a chronic condition, because that's what it is. It takes lifelong tools, it takes skills, it takes support, just like having diabetes does. And so I would encourage, as hard as it is, and it's easy for me to say on Zoom, right, that if a family member can have no judgment and come from a place of wanting to help and collaboration, that family member may be more likely to seek help themselves. But when the person who is having increased substance use or is concerned, they can 100% call a clinic like ours. We are offering telehealth sessions right now. We're actually offering primary care as well. We have integrated care here, meaning that we have primary care, we have behavioral health, we have psych, Dr. Sorrell works here. We have multiple disciplines. We have pharmacy and dental as well, so that folks can come to our clinic and get services from many different disciplines, including behavioral health, just over telehealth. So we're offering that right now. I will also say that we're offering medication-assisted treatment, like medications that help with alcohol cravings or opioid cravings. We do offer those medications here. So I want everyone to know out there that's an essential service that we are still offering to folks. And so they can come in, they need to come in for a Withdrawal injection, but they can actually get a telehealth visit and then a consult with me just to talk about where they're at with their use and if they're wanting more help in behavioral health or psych as well.
Because I think that, sorry, I was just gonna say, I think that was a concern too when we, first went on the stay-at-home order. Well, what if someone's going through withdrawal or they were using a substance, can't get a substance? That kind of thing is worrisome too. So it's good to know that you guys are offering those sessions to be able to offer those medications. Sorry, Dr. Sorrell, go ahead.
No, that actually, you mentioned that alcohol and liquor stores were open. That is one of the reasons that they kept them open, because people who may have alcohol use disorder, if they stop immediately or try to quit cold turkey, they can actually go into withdrawal that can truly cause physical harm. So this is a good time, if you are using substances, to recognize, I'm having to recklessly go to the liquor store and expose myself to COVID to get more liquor. This is a time that I can make a decision for myself to say, hey, I realize that this is a problem for me because I'm going out even though I should be at home. I've been drinking for a while, so I've been diagnosed with high blood pressure, high cholesterol, as the doctor was saying. So I'm actually at high risk to get COVID, but I'm still driving to the liquor store to try to buy it. This is a good time to say, have that aha moment to say, maybe this is a good time to stop, and then calling us at Sheridan Health Services so we can walk you through a plan to really kind of get your life back together. One thing that opioid clients that may be using opioids, the trafficking of opioids is actually lower now because there's not a lot of people traveling. The sales of opioids illicitly on the street are less because those people that might be selling are less. So this is a time where people might be more likely to start to have withdrawal symptoms. Rather than keep on that roller coaster of use and just fighting to not go into withdrawal, this is a perfect time to say, hey, let me call Sheridan and get some help. Let me get some behavioral health services to help with the stresses that may be triggering my substance use, and to get on a medication-assisted treatment plan that will help me not have cravings for substances. So that's one less stressor while I work on feeling better and getting better.
Yeah, I think that's all great advice. And I wanted to show people today too what telehealth is like, because we keep talking about telehealth. I think especially with a substance use or a mental health issue, it might be kind of a daunting thing to think about as far as privacy goes. And mental health, there's still some stigma around that. So people may not be as comfortable doing a telehealth session, or maybe some are more comfortable. And it's hard to tell right now, but I wanted to show people what it's like. So I'm gonna turn my camera off, right? And you guys are going to go through a demonstration about telehealth and how this would work. So again, they're going to demonstrate a telehealth session to give people an idea of what that would be like if you needed virtual help right now.
So the client will actually get a link that brings them into the Zoom room. And so when they click on that link, they'll be on the room. Hi, my name's Tanya.
Hi, Tanya. I'm Nicole. I'm a behavioral health therapist here at Sheridan Health Services. Tell me, can you confirm your date of birth? You don't really have to, but I would want to confirm date of birth. Mm-hmm. And Tanya, where are you doing your telehealth session from?
I live in Denver, and my primary care doctor said that I was so stressed with everything that's going on and being worried that I might get COVID that I needed to talk with somebody about it. I can't sleep, and I'm getting all shaky and panicky, and I really don't know what's wrong. I can't keep myself calm.
Sure. That's a sign of the times, right? A lot of folks are feeling the same way. I'm so glad you were able to connect with me today. So I want you to know that through telehealth, everything we talk about is still confidential. My job is to keep you safe and just keep us safe. And so we can do our work right here, and everything that we talk about stays right here. So it's just as if you were actually in my office for a counseling session, okay? And we can start working on some of the things you're talking about.
But they were saying on TV that people were like Zoom bombing, or like we're coming onto the Zoom session and knowing that you were talking about something really personal. Is that going to happen with me?
Yeah, that is scary to think about. And I have heard that that's been happening. So actually, I have the ability to lock our meeting. We have CU Zoom because we're a CU nurse-led clinic. And so our Zoom is very secure. I just locked our meeting. So everything's confidential and no one else can come into our session, just like a regular counseling session.
Okay. So nobody else can know what I'm talking about. I'm just talking to you.
Yes, you got it. It's just me and you.
Okay. So it's kind of like I'm in the room there, but being here, especially during this time, I'm kind of scared to go out of the house, even to go somewhere, because I'm worried about getting that COVID.
You bet. So this is a great alternative for us to still do work together and have it still be confidential and safe.
Okay. I really hope you can help me with my nervousness, because I've been really, really worried.
Yes. And so at this point, I would say, tell me more about that, and then we'd get into our session.
Stephanie, that's what a telehealth session would look like. So it's very secure. There are steps that we have in place now to make sure that it's just you and the therapist working together. And at Sheridan, we can work with you and follow up and then triage, even if you might have not only emotional health issues that are causing you concerns, but also physical health issues, because we have triage nursing students and nurses that are actually listening, that are working and able to talk with you through Zoom if you have physical or emotional health needs, and we can start the process of getting you help.
Great, and you guys sent me some helpful links and resources that I'll post in the comments as well when I get off of here. Just resources for everyone out there, and to Sheridan Health Services if someone does need to seek out help. Thank you for giving us that demo of telehealth and explaining that, yeah, it's over Zoom, it's over the internet, but it is still a secure way to get treatment right now. And it is something that people were using before this. It's just being used now, obviously, a lot more, and any providers that weren't using it were kind of thrown into it and have to start using it now. So we all have to kind of learn as we go. I didn't want to mention that we have an additional resource for mental health. You can go to 9healthfair.org and take a mental health screening for anxiety or depression. We have those on our website, and you'll be connected to some free virtual help. if you need it, but it's all anonymous. You can go and take a screening on our website, 9healthcare.org. Also, if you have any other medical questions right now that you want answered, if you know someone that doesn't have a computer or access to this, like our Facebook Lives to ask questions, you can have them call our 9Health Neighbors line. It's 303-698-4455, extension 2005. They'll reach a medical volunteer, or they'll leave a message, and a medical volunteer will give you a call back within 24 hours, and you can chat with a real person, ask your questions. Just, nice to talk to someone as well. And then I want to mention today, really doesn't have much to do with what we're talking about right now, but I guess it has something to do with all of us all the time, but it is National Health Decisions Day. It exists to educate you about advanced care planning, and advanced care planning includes making those tough decisions about the healthcare you want to receive if you were facing a medical crisis. So kind of leaving those directives for family, friends to make decisions for you if needed. Sometimes conversations about these things that we don't have power over give us some power, empower us a little bit, and give us a sense of control. So we have some resources on our Facebook page, on our 9Healthcare Facebook page, and I post them also on the 9 News Facebook page. There's some free webinars and from the CU Anschutz Multidisciplinary Center today at 3 p.m. And there's other free resources today where you can learn more about advanced care planning, something maybe we're thinking about right now with the COVID crisis. But I want to thank these ladies for joining me and talking about substance use, knowing when you have a problem, gave us some good insight and some good tips today. So thank you both for joining us, and I will let you both go.
Thank you, Stephanie.
Have a great day.
Take care. It was great talking to you. Be sure to